video conference.
Wonderful, thank you. And I'd like to introduce Jocelyn Martinez, who is in chambers to provide Spanish interpretation services. Jocelyn, could you make a brief announcement about the interpretation services available?
Buenos días, Jocelyn Martínez, intérprete de español. Se les anuncia que le bienvenimos su comentario en español. Antes de comenzar su comentario, por favor, pida la interpretación y tendremos el servicio. Gracias.
Wonderful, thank you so much. We will get our meeting started with the Pledge of Allegiance, and I will ask, is that Charles McKee I see in chambers, if you would lead us in the Pledge of Allegiance.
Of the United States of America and to the republic
For which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Are there any additions or corrections to the public agenda today?
There are no additions and corrections.
Great, thank you. So we have one item on our regular agenda to consider adoption of an urgency ordinance requiring the use of face coverings indoors by all persons over the age of 2, regardless of vaccination status, with limited exceptions. This would require a 4/5 vote, and we have a 10-minute presentation from Les Gerard, and possibly with support from Susan Blitch. Les, I'll pass the microphone over to you.
Thank you very much. Good morning, Honorable Chair and members of the board. Let me share my screen. So hopefully on your screen, you see the draft ordinance that was provided with the agenda and the agenda packet. What I intend to do is scroll through the ordinance, highlight some of the recitals that lay the record for the adoption of the ordinance, and then scroll through the substantive portions of the ordinance so everybody understands what it calls for. So the ordinance begins with reciting the history of the pandemic here in California, including the proclamation of a local emergency signed by the CAO and then ratified by the board. It then also talks about the rise of the Delta variant and the danger that that poses to individuals in the state of California, including Monterey County. It also notes that Monterey County is a popular tourist destination, and we attract visitors from all over the state, much less the country, places where the positivity rate is conceivably higher than Monterey County's current rate. The recitals go on to recite that the CDC issued guidance recommending that fully vaccinated individuals wear face coverings indoors. The CDPH, California Department of Public Health, did the same. And Monterey County's health officer has a recommendation that the individuals wear masks or facial coverings in indoor settings. Currently, Monterey County's community transmission designation by the CDC has actually fluctuated between substantial and high, and the CDC has called their guidance to for people to wear facial coverings indoors in counties or communities with substantial or high transmission rates. There was recently a large-scale randomized trial study performed by researchers at Stanford and Yale universities, which confirmed the effectiveness of surgical masks in reducing the spread of COVID-19. We are surrounded by counties that have adopted indoor mask requirements, including, as you see on your screen, Alameda, Contra Costa, Marin, Napa, San Francisco, San Mateo, Santa Clara, Santa Cruz, Sonoma, and San Luis Obispo counties. And indeed, our current information is that 28 out of California's 58 counties have adopted indoor facial covering requirements. The recitals go on to indicate the authority of the Board of Supervisors to take actions by an emergency or an urgency ordinance to protect the health, safety, and welfare of its citizens. In addition, because the pandemic does not respect political boundaries, the declaration of the proclamation of the local health emergency covers the entire county, including the incorporated and unincorporated areas, and therefore your ordinance, if adopted, would apply within both incorporated and unincorporated areas. That concludes the recitals. There is more background set forth in attachment A to the board report. So now let's turn to the substantive requirements of the ordinance. So basically, the ordinance would require, regardless of vaccination status in both the unincorporated and incorporated areas of Monterey County, all persons over the age of 2 must wear a facial covering, which covers both the mouth and the nose at all times, with 3 exceptions. And I want to point out that this ordinance was actually modeled after the health officer orders issued primarily in the Bay Area, but also Santa Cruz, San Luis Obispo, and other neighboring counties. So the 3 exceptions where an individual is in their own residence or in a closed room, office, or vehicle alone or with members of their household, when they are actively performing something, an activity that cannot be done while wearing a face covering, i.e. actively eating or drinking, swimming, showering, or obtaining a medical or cosmetic service requiring the removal of a face covering, for example, dental work or something similar. And finally, where specifically exempted from the use of face coverings under guidance by CDPH, and we've listed the website in the ordinance so people can easily access those exceptions. The ordinance goes on to require all businesses, including governmental entities, owning, operating, managing, or occupying indoor facilities to enforce the facial covering requirement for all their personnel and customers or members of the public entering their facilities, regardless of vaccination status. Businesses and governmental entities must post clearly visible and easy to read signage at all entry points. In addition, those responsible for indoor public settings are strongly urged to provide facial coverings at no cost to individuals who do not have one upon entry. This is a strong encouragement or recommendation. It is not a requirement. Finally, because we all know that young children between the age of 2 and 10 are sometimes hard to control, the ordinance requires all persons accompanying or responsible for children between those ages to use reasonable efforts to ensure that such children wear facial coverings when required. There's some definitions. A definition of a face covering is one that's been around for quite a while. It has to cover the nose and the mouth. It can't have any visible holes or openings. But a face covering does not include a scarf, ski mask, balaclava, bandana, turtleneck, collar, or a single layer of fabric. A facial covering needs to have at least 2 layers of fabric. A business is defined as any for-profit or nonprofit or educational entity with a corporate partnership, sole proprietorship, et cetera. And personnel are basically the people who provide the goods or services or perform operations associated with a business or a governmental entity. The ordinance provides that the facial covering requirement will go into effect next Monday. This will give businesses time to be ready, to have the signage posted and be ready to meet the requirements of the ordinance. The ordinance also provides that it shall terminate at the earlier to occur of Friday, November 12th, which is 60 days from its effectiveness, or upon order of the Board of Supervisors, unless the ordinance is renewed or extended. Under enforcement, the ordinance may be, a violation of the ordinance may be processed as an administrative violation pursuant to the provisions of the Monterey County Code. For purposes of this ordinance only, an enforcement official includes any officer, employee, or agent of a city within the county or anybody so designated by that city. Generally, in the Monterey County Code, county officials are designated as enforcement officials. The ordinance requires that members of the public abide by any stricter requirements that may be issued by the state public health officer, the governor, or any state agency, for example, Cal OSHA. The ordinance provides that it is to be liberally construed to provide the broadest possible protection. The county administrative officer, county council, and all other county officers and department heads are authorized and directed to take such other and further actions as may be necessary or appropriate to implement the intent and purposes of the ordinance. And finally, because the county cannot require city employees to undertake responsibilities, the ordinance requests that all city managers, city attorneys, and other city officers and department heads take the similar actions as may be necessary to implement the intent and purposes of the ordinance. There is a standard severability clause, and then finally it ends with an effective date paragraph. The ordinance is effective immediately as an urgency ordinance, but as mentioned previously, the facial covering requirement will not take effect until next Monday. So that covers the ordinance that was in the agenda packet. I would point out, let me stop this share and share a different screen. I do know that there has been some communications from, for example, the Pebble Beach Company, the Monterey County Hospitality Association, and maybe others, requesting a different exception to the ordinance. I have revised it a little bit, but this is the request which the board can direct if it desires. The other exception would be where all persons present show proof of vaccination, which is 2 shots of a 2-shot regime or 1 shot of a 1-shot regime, or show proof of a negative COVID-19 test performed within 72 hours of the gathering, event, or meeting. So this was a request made by a number of entities which the board can consider if it desires. That concludes my presentation. I'm happy to try to answer any questions.
Great, thank you very much, Les and your team for drafting this up and the presentation. I will bring it to my colleagues for questions at this point, and then we'll go out to the public for any public comment, and then bring it back to this board for consideration. We'll go ahead and ask everyone to use the raise hand feature so that I can call on you, both for my colleagues and for the public. And we'll start with Supervisor Chris Lopez.
Just a quick question for you, Les. Are you aware of any other counties where the Board of Supervisors have been the ones to take this action rather than the health officer currently in California?
We are not aware of any other Board of Supervisors that has taken action. It's our understanding that all 28 counties that have a similar requirement, it was issued by the county's health officer. There are 3 cities in California that have issued a facial covering requirement. That was adopted, 2 of them by the city councils. The city of Berkeley has its own public health officer, one of the few cities that does, and that health officer issued the city of Berkeley's order.
Thank you.
Supervisor Alejo.
Thank you, Madam Chair. And I first want to thank our county council for drafting the language and fine tuning it with some of those requests from the community. But I think this is one of those moments where we as a Board of Supervisors can demonstrate leadership. And we have repeatedly asked our county health officer, Dr. Moreno, to consider issuing an order, knowing that 7 other Bay Area counties first moved to do an indoor mask order at the beginning of August, and then it was followed by our neighboring county to the north, Santa Cruz County. But unfortunately, he's unwilling to do what his colleagues have already done. And I think this is a time for the Board of Supervisors to continue to provide leadership and taking a step that I think will help Monterey County stay ahead of COVID infection, hospitalization, and deaths. We know that right now there was a recent press about Monterey County being one of the 3 who are not yet in the high tier. We do not have to wait to get more infections and enter into the high tier before we decide to act. I think if we take this measure, and as Supervisor Lopez requested, we're making clear that it's temporary. It's doing what our public has already done that we know works and helps prevent spread of an airborne virus. And there's going to be a date. We're going to sunset this at 60 days and review it then. But this lets the public know it's intended to be temporary. But since the end of June, seeing that we have 50 additional deaths, 3 just yesterday, what we do now, if it saves one life, if it prevents one of our county residents from being hospitalized, this is that moment for us to be able to do that. And I think there's been other moments throughout this pandemic where we've, as a board, have asked for different measures. Sometimes it's been frustrating because we had wanted our county staff to do things that I think would help prevent, and it took a lot of work to get there in past efforts. But this is another one of those examples. But I'm glad our county council provided that clarity, to be on strong legal ground, that we can move forward as perhaps the first county board of supervisors in Northern California or in the state that says we need to act to do this at a critical time for our residents. For me, I think I know this is not an easy decision. I know there is disagreement with it, but if we could show that it's temporary and that this is going to help us stay ahead and not have to, hopefully not get to a point where we're looking at closing down our economy, closing down schools, small businesses. We've already been there, done that, and that hurt a lot of our residents. It hurt a lot of our small businesses. It hurt tourism coming to our area. It hurt farm workers that were the most impacted occupation out of all in our county. We have progressed, and that is because of the resilience and the commitment of our residents, our health professionals, our nurses, our doctors, our educators, everybody who has really sacrificed and who has really stepped up during these most challenging of times. So I think this is something that we could stand united, hopefully unanimous today, to take this step that I think will go a long way in helping curb this horrible pandemic that has already taken the lives of so many and has disabled many who have been hospitalized. I know my own family members. I have an uncle who has remained on an oxygen tank, has not got 100% since being hit by COVID. So I personally know this has hurt those closest to us. We lost Debbie Aguilar, a peace champion, lost her life to COVID. But there's another hundreds of more Debbie Aguilars that had hoped to come back from the hospital, to be reunited with their families, to spend more holidays and birthdays. But sadly, they can no longer do that. There's been enough pain and suffering. And I hope that this can prevent at least saving some more lives and keeping more of our residents out of our hospitals. With that, I want to move to support this recommendation today drafted by County Council with the added language by, as was explained by Les Gerard. Thank you, Madam Chair.
Thank you, Supervisor Alejo. I'll second your motion, but we'll go to Supervisor Phillips for additional conversation.
Yeah, and I gotta say I really believe in masks, and we got a lot of emails in, people disagreeing with the effectiveness of masks. And I really believe in masks, but and I was one of those that was out in front last week proposing that we support this amendment, mainly because of the influx we saw at our schools, especially North County, but now we see King City and Carmel. But and I thought we had everything I thought we had strong support from the community on this, but now as the word got out, that hasn't been the case. I mean, there's real diversity in opinions about it. And I gotta say, I have problems with our numbers, whether they justify us. Now there was like 48 in the hospital last week. Now it's 28. We see a lot of things. I have a serious concern whether our numbers justify us overruling our health director and moving forward. And I am concerned about if there's this much resistance, the enforcement of it. It bothers me because I see those people rebelling up and saying, well, we did everything you told us to do. We got vaccinated. Now we're back in there. And now you're coming in and telling us, and it's not the health director telling us, it's you telling us. And I think just the compliance, there's no way you can enforce this without having voluntary compliance. And I think this may have a counter effect of getting compliance when now we go into a business and they say, if you want to come into my business, you want to come to my health club, you got to wear a mask. And if you don't want to come in, that's fine. But I see an energized resistance and saying, well, it's not the business saying we need this for the safety. It's government saying this at this point in time. And you looked at our numbers yesterday. I think we're improving, but that's just a concern. And admittedly, I'm kind of about 180 from where I was last week.
Thank you for your comment, Supervisor Phillips. Supervisor Adams?
Yes, thank you very much. I'm very interested to hear from the public on this item as well. We've received an incredible amount of communication from people in our district office, and I know the board has through the clerk as well, on both sides of the issue, but I think primarily coming from people who are not supportive of our doing a mask mandate. At least that's what we're hearing from our office. But I did have a couple of questions, and I just wanted to know what is really different about our current rates compared to the spring when we had the mask mandate. Is there anyone that could answer that question? You know, if we look at where we are from now compared to then.
Do we have public health on the line with us? Is Elsa Jimenez with us today, or Dr. Moreno, who can answer the epidemiological question?
Or maybe Christy?
Yeah, good morning. This is Elsa Jimenez. Unfortunately, I don't have that information readily available. I don't know if either my colleague Christy or Dr. Moreno do.
I guess to maybe put the question a little more broadly, if this were where we were before, would the numbers today mean that we would be in the purple tier? The numbers that we have today, do we know the answer to that?
Good morning, Ed Moreno, Monterey County Health Officer. Hi. So we do have information. I don't know what the latest is, but I know we're not in the purple tier. I don't even think we're in the red tier. I think at this point we would be in the orange tier at this point, based on the California blueprint, which has been retired, as well as all the nearly all the guidance documents that were associated with the California blueprint.
Okay, I'll ask a different approach then. Thinking about the children in the county, this is the group that has really got me more concerned than anything else, actually. But thinking about the children in the county, mostly in the age group that are not yet vaccinated, what are the average number of cases for children 0 to 17?
I don't have the average number of cases, but what we've been doing through this pandemic is we've really been focusing on rates. We really can't compare numbers between groups, but we can compare rates. And so we have been looking at the rates by age group. And at this point, the lowest rate of COVID-19, that's case rate, the lowest case rates right now are among ages 0 to 5 and 75 and older. And those are the lowest rates right now in Monterey County. We have also looked at the school age group, looking at primarily 5 and up that are not eligible for vaccine, and 12 and up which are eligible for vaccine. And among the approximately 6 to 11-year-old group, I believe they are trending right now. Their case rates are trending just below the median for the county. As far as the school age children who are eligible for vaccine, they are above the median, and they're trending along with those young adults up to age 24. So when you look at the broad range of children, the ones with the lowest are the ones that are 0 to 5 and ineligible, then a little bit higher for school age children who are ineligible for vaccine, and then higher yet for those that are eligible for vaccine who are primarily in high school.
I guess it just feels pretty shocking when you hear that 15 kids in high school just came down with it in one school. It's enough to really give you pause. I think one of the things that I keep thinking about is just looking at the enforcement of the mandate, as we had talked about. And I'm wondering if this would be the appropriate time, or if we've been able to offer any more support or resources to the people, the customer facing staff who are going to have to be in a direct position to enforce this. I've heard from so many businesses about people being angry or disrespectful or even abusive to the forward-facing workforce. And I'm worried about people taking it out on staff and putting people in harm's way. Anyway, that is just something that I'm conscious of. Also wanted to know, as we talk about this, and as I say, I really want to hear from the community, and I've got some other comments after that. But I'm just wondering, if we talk about this, if there is if we have to keep it at 60 days, or if we chose to, we could modify this to be like just a 30-day time frame, and that we would revisit every 30 days. That there's nothing that would prohibit us from doing that. Is that correct, Les?
That is correct. The board could direct modifications to the ordinance in terms of its effective date, its termination date, and other things that the board might be interested in.
Right, thank you. Because I know that if we look at national or international statistics, they're showing that, especially with the Delta variant, things just spike up, and then quite quickly they go down again. I don't know whether that's going to be true for our unvaccinated youth, but that's certainly something that we've been thinking about. So perhaps having just a shorter mask mandate might be something that would be a bit more palatable to the community. But at any rate, I'm very interested in hearing from the public, and then I'll have more comments after I get to hear from folks. Thank you.
Thank you, Supervisor Adams. I'll just make a few comments before we got to the public. I think that I would ask my colleagues to keep in mind that when we look at our COVID rates currently, we really need to consider what the rates are among our unvaccinated residents of this county. That includes 90,000 children. That includes 60% of our Black residents who are not yet vaccinated. Our children are, yes, always we need to hear from the community, and I've appreciated all of the communication that has come into us. But I do want to make it clear that our children are not typically engaged in the democratic process. They're not able to look at the big picture data and advocate for the positions that are going to protect them or their families. And so my responsibility here today as the mom of a child, as a resident in our community who has seen the impact that this pandemic has had on families, is to speak out loudly and clearly and appeal to my colleagues to do what we have in our power to mitigate the impact of this pandemic as it continues to ravage through our community. The data that I'm looking at today goes beyond the specific health data of the deaths, as Supervisor Alejo referenced, the hospitalizations that we know can leave people with long-term damage to their heart and lungs. It goes beyond the fact that the testing positivity rates. But what I'm hearing from our colleagues in the field of the healthcare field is that we have critical nursing shortages. That it's next to impossible to hire nurses if we need them. The nurses who we have are exhausted. They are they've given everything they can for the past 18 months. So my responsibility is to our healthcare workers. My responsibility today is to look at the fact that we're hearing that there are testing shortages headed our direction across the state. My voice here today is for the teachers and the school officials who are struggling day by day to keep kids in classrooms, to get testing out to students, to deal with parents who don't have the ability to take off work to quarantine their children when there's an outbreak in a classroom. The chaos and stress, the level of chaos and the level of stress on families is overwhelming. And so that is data that's relevant to our conversation today. It's a data that's relevant to keeping our workforce up and running. It does go beyond the tragedy of the deaths and the hospitalizations, but it's data that we as policymakers have to consider in terms of how we set policy to allow our economic drivers to continue operating, to allow for the children who we fought so hard to get back into school to stay in school. So I would appeal to my colleagues on this board to look beyond that hospitalization and death data to really understand the impact that this pandemic continues to have on families who feel as though, right or wrong, they have been left behind at every policy decision this past year. And I mentioned this last week, but I'll say it again. You know, we as policymakers at the state and local levels were talking about how to reopen golf courses before we were engaged in how to support schools reopening. Bars and gyms were reopened before schools were reopened. The action that we can take to protect those who are unvaccinated in our community, to keep schools open, to keep our businesses open, to keep Monterey County a safe place for visitors to come to us, I think it's incumbent upon us today to make the right decision. So I see Supervisor Phillips, you have your hand raised again. Do you want to comment before we go to public comment?
Yeah, I just had a question. One of the things that impacted me last week when we were considering this was that we had a letter from a number of people who represented cities, and about 4/5 of our cities were represented. But the more I'm hearing from there, I'm not sure that they necessarily represented the position of the cities. I know I talked to the mayor of Salinas yesterday and see if they had a position. She said, well, we don't have any intention to institute a mandate away from where the city, but I was questioning, have we had any input from the cities where they stand on this, if they support it or think it's a good thing, takes them off the hook from having to do it? I don't know. I don't know whether Charles but I haven't seen any emails come in directly from cities. We've seen Chamber of Commerce and Farm Bureau and other. I haven't seen it from cities. So just query. Thank you.
Madam Chair, I can comment on that somewhat from my perspective. I would say it's mostly anecdotal, similar to what, the letter in some ways is that there are members of city councils and mayors across the county who both support a requirement for masks as well as those who oppose it. I don't think there's any uniformity either within the cities or among their residents.
Supervisor Adams?
I do know that there is uniformity in the belief that if we do it for the county, we need to do it for the cities. That it would be very difficult for the average person, whether it's us or if it's a visitor, to realize, oh, I can do this in the city of Pacific Grove, but I can't do it in the city of Carmel when the cities are virtually contiguous. So I'm conscious of that. About 2 weeks ago, we had a meeting with our mayors in Monterey, Carmel, and Pacific Grove, who were supportive of doing a countywide mask mandate. I've not spoken to them in the last week, so I don't know what the current feeling is, but that was certainly the thought at that point.
And I would add that the conversations that I've had with folks, I think that once they got the sense that the county was moving towards taking action, I'm not sure that they felt that they needed to send anything more formally than what, as individuals, the local electeds, at least in the 5 cities that I represent, had signed on to support. But if that is a need that we would need to justify their support, we could put that word back out to them. And I'm sure that many of those that I represent would communicate clearly their expectations. Supervisor Alejo.
Yeah, Madam Chair, I was just going to add though, this we have to recognize that as a tourist destination, we get visitors from all over the world. Every week, especially on weekends, we get a lot of residents, and our workers are at risk when they're working in confined areas, in restaurants and hotels, and a lot of other businesses where there is close contact. They are the ones that we are putting at risk if we do not move forward and take these additional, this temporary measure to better protect them. Because at the end of the day, they go back home and they put their children, they put their spouses, they put other household members at risk. So we shouldn't be repeating the same thing we heard in the past, that, well, our numbers are not as bad, so maybe we shouldn't do that. And we are not overriding Dr. Moreno. Dr. Moreno had an opportunity to make his own independent decision. He chose not to do that. So now us as a board, as we do on many other issues, are exercising our independent decision-making power to protect our residents, especially our most vulnerable. I want to remind us that I remember when I was pushing for the first shelter-in-place order, March 15th of 2020, we had a meeting on March 16th. Again, I heard those same arguments. Let's not do a shelter-in-place, because at that point, we did not have any COVID positive cases. San Benito, San Luis Obispo, Santa Clara, Santa Cruz did. Monterey did not. The next day, March 17, 2020, we had our first 2 cases. And that's what caused this board to say, okay, it's time. We shouldn't have to repeat that. We've learned those lessons in the past. We shouldn't have to wait till we're in a worse situation when we could take actions that could prevent us from getting in a worse or more dire situation. It's just kind of hard to hear the same explanations of the past when we should have learned from that. And now with our experience and a lot of the pain and suffering and loss, we should even be more so encouraged to do the right steps that will help prevent further illness and loss. Thank you.
Okay, let's go out to the public. I know we have a couple folks in chambers, and we'll start with in chambers public comment. We will maintain our 1 minute and 30-second timer for public comment, and I would just ask that you introduce yourself and please watch the timer so that I don't have to interrupt anyone. That would make me grateful today. And we will welcome our first public comment in chambers.
I'm going to take my mask off just as we do in restaurants and closed areas so I can eat and drink, which sounds so stupid. My name is Chad Lindley, resident of Chular Canyon. Just wanted to talk today. We had a major shutdown. We had the mask mandate and our numbers were out of control earlier this year. And now our numbers are getting better. And then the Delta comes up, and now we want to have a mask mandate. For 1.5 years, Health Officer Dr. Moreno was the guy that the supervisor said we need to go with what he says. Now our supervisors want to say we're the doctors, and we're going to make our own decision and not go by what Dr. Moreno says. Alejo said it in his statement. Our county is already doing it. You go into most of these stores, and almost everybody has their mask on already. There's no data that will save anyone. Business owners, I agree, can have their policies where you don't have to have a mask, or if you don't have a mask on, you can't shop there. I'm good with that. But I don't think the county supervisor should be making rules. If they want to have no shoes, no shirt, you can't get it, no mask, I'm good with that. For 1.5 years, we've heard about follow the data. Now we ask the health department, they have no data. Oh, we don't know the numbers. Why are you worried about the unvaccinated now? You can get vaccinated if you want to. Supervisor Lopez is my supervisor, and I just tell him to stand strong with this. Thank you.
Thank you for your comments. Is there another public comment from the board chambers?
Yes, hi too. I will remove my mask. My name is Amy Zanetta. I live in Gonzales, and I believe this is the United States of America. This is the country that we live in. This is a free country. We all live with risks. These meetings that y'all have seem like a pretty waste of time to me. Pretty much when you are here with no data. There's no medical people that you refer to that are here that can provide you with anything. You're making decisions. You already have documents drawn up based on every other county, based on data that I am familiar with because I do all kinds of research from all kinds of different places that indicate the numbers are low. I believe in allowing risk, individual risk. That should be allowed because this is the United States of America. This is California, which is in the United States of America. This is Monterey County, which is in the United States of America. This is Salinas, Carmel, Monterey, Seaside, Marina, Gonzales, Chular, King City, Soledad, Chular, whatever you want to say. This is the United States of America, and we have freedom. People have said there are no statistics about children. They are the least of our concern. Our poor children have suffered. Look at the suicide rates. I'll finish. Thank you so much for listening to me. I'm sure you'll take it into consideration. Thank you.
Thank you for your comments today. Is there anyone else in chambers for public comment? And I'll ask the clerk if there's anyone else in chambers.
Not that I can see, Chair.
Okay, great. Thank you. We will move over to our Zoom call-in participants, and we'll call the two names. You'll need to unmute yourself when we give you permission to unmute. And again, I'll ask that you just watch the clock and introduce yourself for your comments today. We'll start with Zoe Schotz, followed by Katie Anigoni.
Good morning. Can you hear me?
We can. Thank you for joining us.
Thank you. Zoe Schotz, a resident of Pacific Grove. I am in support of the mask mandate indoors. I'm an essential employee working indoors where we are following the county mandates as an organization. My work does not currently support such a mandate because the county does not. I have 2 young children, ages 4 and 7, who are unable to be vaccinated. I am vaccinated myself, but concerned about the rise of the Delta variant and breakthrough cases. After being cautious for the last 1.5 years and being able to do so since a policy, I'm disappointed that this is continuing in a time when children are not able to be fully vaccinated. I sent my 7-year-old back to school this year for 1 day. In her class, she had 2 positive COVID cases. There have been 5 overall at the school. I'm talking about a 7-year-old who's afraid to go to school. I cry for her. Recently, we've seen 15 cases at Carmel High School. Those are only of the football team that has been tested. We do not know how many other cases are appearing in those classes. We pulled my daughter after the first date. We're now doing independent study, and let me tell you, it is independent. I work full-time. She has a substitute teacher, has not turned any work, has no technology available to her. My 4-year-old is not able to attend preschool. I beg of you, please, please institute this mask mandate for the health of my family, so my children can have friends, so my children can resume life. Thank you.
Thank you for your comments. Next up, we have Katie Anigoni, followed by John C.
Good morning. Can you hear me?
We can. Thank you for joining us.
Thank you. My name is Katie Anigoni. I am a resident of Pacific Grove and a lifelong resident of Monterey County. I am in support today of a countywide indoor mask mandate. I am a mother of 3, one of whom is under 12 and cannot be vaccinated as of yet. She and other children like her need the protection an indoor mask mandate would provide. It is such a simple thing that we can do that can save lives. I urge the community and the public to put aside our freedoms and anger and do a simple act of putting on a mask and protecting our most vulnerable. I appreciate the board of having this vote, and I urge you to vote today to pass this mandate. Thank you.
Thank you for your comments. Next up, we have John C., followed by Curt Gonzalez.
Yes, am I audible?
You are. Thank you for joining us.
Esteemed supervisors, anecdotes are irrelevant. Science and ethics are what is important. We healthy families of Monterey County unequivocally reject any new harmful both biologically and psychologically harmful new indoor mask mandate. The Bangladesh mask study is deeply flawed. Its data simply does not add up. It is not truly a study of mask wearing. That study destructed its own self. And this Bangladesh mask study still does not claim a significant difference from mask wearing with a level of confidence that any reasonable person can accept. However, many other reputable studies show conclusively that masks are not only ineffective, but actually harmful to health. I have sent you links to some of these sources. You as busy supervisors require additional time to become aware of the deep flaws of this study. Furthermore, your invocation of the children is specious. Young people are not at risk from COVID. Under the age of 18, the risk is 1 in 500,000. That is 2 in 1 million of dying from COVID. That is no higher than from the flu. I have anecdotes too. I have teenage.
Thank you for your comments today, John. Next up, we have Curt Gonzalez, followed by Robin Pelk.
Hi there. My Zoom name is apparently Curt Gonzalez. This is Nicole Alexander. I am a Marina resident, community activist, currently campaigning for mass choice for our children in schools with a group called Let Them Breathe, who currently has a ongoing lawsuit against California. I do not support mass mandate. I do support mass choice. School districts are overreaching. Your board members or you board members are overreaching, and especially if you want to go against the recommendations of Mr. Marino. I did want to just simply state we do have our 14th Amendment, our federal constitutional law of freedom. And I would like to ask you all, how do you speak to those people who are freedom fighters who would like to utilize their constitutional freedoms? How do you speak towards SB 577 signed into law by Governor Davis, who unquote says the bill provides adequate standards for California consumers and enables them to make informed choices regarding their personal health care, their personal freedom. I urge you all to please consider the data. You stand and say, we follow science. Well, there's plenty of science that goes against mask mandate. It's very apparent that they don't work, as all these kids are coming up with being testing positive. Thank you.
Thank you for your comments. Next up, we have Robin Pelk, followed by Harmony.
Thank you. Yes, I support the mask mandate. Monterey County case rates are not low. As we heard today, they're fluctuating around the substantial to high transmission tier, where CDC is still recommending universal masking, and it's well above mitigation thresholds we used last year. And there's concern that cases could trend up quickly in the winter surge and holiday travel surges. But most importantly, we're lumping together cases across all ages, and that's obscuring an increasing trend in case rates in young kids. Kids who are too young to be vaccinated and are now back in school. So I've already sent data via email showing that if you pull out the cases in kids, those cases are still increasing in California. But what I can tell you as a parent is we're seeing positive cases in local schools all the time. And every time that happens, not only are we worried about kids getting sick, but we have kids missing out on their education. We already had to quarantine an entire elementary school classroom, and this is creating huge stress on kids, on schools, and on working parents. And it's the greatest risk of all is faced by our most marginalized kids who don't have as many resources at home for healthcare, for testing, or if this becomes needed for online learning. We know masking is a tool that can bring those cases down, and that the faster we bring down cases in the community, which is where kids are first picking up COVID, the more hours our kids could spend learning instead of getting COVID tests or being stuck at home in front of a screen, or worse, because the fact is that 1 in 100 kids diagnosed with COVID do end up needing hospital care. And finally, I want to say working parents and teachers I know overwhelmingly support this mask order, but they just don't have the time to call and write in. So please take that into account. Thank you.
Thank you, Robin, for your comments today. Next up, we have Harmony, followed by Alma Loredo.
Hello, this is Harmony D'Angelo. Can you hear me?
We can. Thank you for joining us.
Thank you. I speak as a business owner a essential employee and a parent of 2 small children, and I oppose this ordinance to mandate masks. Article 9 or 11, Section 7 is not applicable. The conflict with common law to move freely, more so to possession and control of one's own person from restraints and interference of others, does not meet the clear and unquestionable standards that the objectives of the ordinance lay forth. The burden of proof on legislators to demonstrate that the risks outweigh the benefits regarding CO2, bacterial exposure, and the fact that natural immunity is the broadest exposure. We are in the purple tier. We already have probably a large percentage, nationally it's 1/3, it's been said, have already had COVID and have antibodies. The Yale study is referring to surgical masks, does not allow for the N95 dangers for long-term use or the short-term cloth mask. The health officer does not mandate. A recommendation is not a mandate. The Board of Supervisors need to clarify the risk reduction. I don't have all my stuff. I'll try again. Thank you.
Thank you for your comments today, Harmony. Next up, we have Alma Laredo, followed by Teresa S.
Gracias, supervisora. ¿Puedo hablar en español?
Yes, please proceed. Well, have you, and do we have our Spanish interpretation available? Let's just make sure that we have everything ready to go.
Yes, we do. Let me just give the instructions. Thank you.
Okay.
Buenos días. Por favor, hable lo suficientemente recio y lento para que le entienda. Por favor, tome pausas después de sus oraciones y yo hablaré después de usted como si usted estuviera hablando. Adelante.
Buenas tardes, miembros de la mesa. Presidente, mi nombre es Alma Laredo.
Good morning, members of the board, president, and my name is Alma Laredo.
Soy residente de la ciudad de Salinas y una organizadora de padres en la comunidad.
I'm a Salinas resident and organizer in the community.
Como organizadora en la comunidad, tengo el conocimiento de las preocupaciones de los padres.
As a community organizer, I have the knowledge of the concerns that parents have.
Pero también soy madre y estoy aquí para expresar mi apoyo a la orden del cubrebocas obligatorio.
But I'm also a mother and I'm here to support to show my support to the mandate of face coverings.
La comunidad necesitamos de su apoyo y liderazgo.
The community needs your support and leadership.
Para proteger la salud de aquellos más vulnerables, que son los niños menores.
To protect the health of those most vulnerable, which are the children.
Que aún no están vacunados y ya han regresado a la escuela.
Who are still not vaccinated and have now returned to school.
Y hemos visto cómo los contagios han sido elevados.
And we've seen how the cases have been rising.
Y creo que es la responsabilidad de los adultos cuidar de la salud de los más pequeños.
And I believe it's the adult's responsibility to care for those that are younger.
Ya que está afectando desproporcionadamente nuestra comunidad latina.
Now that it's disproportionately affecting our Latino community.
Queremos evitar fatalidades, así que les pido que adopten la orden de cubrebocas mandatorio.
We want to avoid fatalities, so I ask you to pass this mandate of enforcing face masks.
Hasta que sea seguro para todos.
Until it is safe for everyone.
Gracias.
Thank you.
Thank you for your comments today. Next up, we have Teresa S., followed by Jenny Miller. And Teresa, you'll need to manually unmute. There we go.
There?
We've got you. Thank you for joining us.
I am not in favor of this mandate. I believe since we got rid of the last mandate, people are wearing masks if they choose, and people are not if they choose not to. I don't show any evidence that you provided today that for small children that wearing a mask is going to prevent them from getting COVID, or in any case have them dying. It's a small percentage. I think it should be up to each individual and their right. If they want to wear a mask, they wear a mask, just like it is today. If they are scared of getting COVID or spreading it, then surely they can wear a mask. I think that the community is split, but I think we should have everyone have their own decision when they step out of their house if they want to put a mask on or not. I have a 3-year-old grandson who has never worn a mask, and I am very concerned because there is no data out there, any studies out there on the long-term side effects, physical or emotional or mental, for a 3-year-old to wear a mask at daycare for 8 hours. It's absolutely ridiculous. So until you provide proof and data and science, I request that you hold off on this, because your mandate says, you know, until we extend it or not extend it. We know this is going to continue to extend. So I oppose it. Thank you.
Thank you for joining us, and thank you for your comments today. Next up, we have, oops, here. Next up, we have Jenny Miller, followed by Andrew Renard.
Hello, can you hear me?
We can. Thank you for joining us.
Okay, this is Virginia Jenny Miller. I'm in Pacific Grove. I am very much against adopting this urgency ordinance requiring face coverings. I'd like to raise a few questions that should be answered before we interpret the statistics about the rise in cases. First of all, what is the definition of a COVID case? Is it simply a positive PCR case, including when the person is completely well and asymptomatic? Also, who is doing the Delta testing? Because it's not done with a PCR. 4, what cycle thresholds are these PCR tests being run at? Do you get the breakdown of this crucial information when you receive the number of positive tests? What proof or research do you have that people are actually getting ill from an asymptomatic person? I've not seen that research, and many of the experts I follow around the world say it does not exist. And have you really weighed the potential risk to people's well-being physically, emotionally, socially, and financially to the perceived benefit of such an extreme mandate? I would like to propose a widely advertised open public forum where experts and the general public can debate all the ramifications of these type of mandates. So much is being censored by mainstream media. The American way is about freedom of speech, and real science is about discussion and transparency.
Thank you for your comments today. Next up, we have Andrew Reynard, followed by Rick Aldinger. So we have Andrew Reynard up next.
Yes, I'm sorry, I had to unmute. Hi, I'm currently sitting here with my son who turns 2 in October. I'm really not interested in him wearing a mask at that time. I really appreciate, you know, people's concern about the children, but you know, the data doesn't support the actual risk of mortality, doesn't really support it. I'm looking at a BBC News article from July 9th that says that the overall risk of children becoming severely ill or dying from COVID is extremely low. The article says that scientists at the University College in London and Bristol did an analysis over the last 12 months and found there were 25 deaths, and that researchers estimate that 25 deaths in a population of some 12 million children in England gives a broad overall mortality rate of 2 per million. I also am concerned, you know, my father fought in World War II and my grandfather fought in World War I. They fought for the freedom of this country. They fought for the tenets that, you know, our founding fathers like Jefferson believed that there should be limited, you know, government overreach. Decision that's being made here today doesn't sound like it's in alignment with the public health officers. And the fact that the board of directors is doing this on their own is greatly concerning to me. Thank you.
Thank you for joining us, and thank you for your comments today. Next up, we have Rick Aldinger, followed by Carolyn Swanson.
Thank you very much. Good afternoon. We all know the situation could change sometime in the future, but we're seeing that key metrics continue to decline in the state and to an even greater degree in Monterey County. Last week, the county's numbers were described as alarming. And if we take a look, we see that our current number for new cases per 100,000 population is only 10% of the pandemic's peak last January, and hospitalizations are at 13% of their peak, with both of these metrics continuing to trend downward. Also, the proposed ordinance language specifies that the mandate will be enforced by the individual business, which leads me to believe there could be sanctions placed on the business if they are unable to provide effective enforcement. This is not an acceptable enforcement mechanism. We went through this during round one of mask mandates with detrimental emotional and even physical consequences to our frontline workers. And it is expected there could be even more pushback by our guests this time around. Our workforce is not trained in law enforcement, nor should they be expected to be. Just the prospect of another mandate needing to be enforced by my staff has created a high level of angst among them. We are, to a degree, trading one health risk for another. I personally experienced this on multiple occasions during round one, especially because this potential action would be taken without the support of your health expert. The county should assume the sole responsibility for enforcement on the violators themselves, holding the businesses harmless. And I'm sorry, I failed to identify myself at the beginning. I'm the general manager of the Big Sur River Inn and chair of the Monterey County Hospitality Association Government Affairs Committee. Thank you.
Thank you for your comments today, Rick. Next up, we have Carolyn Swanson, followed by Mark Watson.
Good afternoon, supervisors and staff, including Dr. Moreno. Thank you for all the work that you do for the citizens of our county. I am Carolyn Swanson. I'm a parent in Pacific Grove, and I'm also an elected school board trustee. I'm here today speaking as an individual. We know this pandemic is really a pandemic of the unvaccinated. Our school children 12 and under are not eligible for vaccinations at this time, and families are hoping that vaccines come available for their kids under 12 early this winter. Cases for kids are increasing, kids 0 to 17, and mask recommendations don't change actions, mandates do. We need a mask mandate to get us to the point where our children can get fully vaccinated early this winter, perhaps midwinter. Teachers and school staff and students, they wear masks all day. It's not enough because the majority of cases in schools are coming from community. It's a community spread. I urge you, please vote in favor of a countywide mask mandate today to help keep our entire county up and running and to keep our school children safe until they're eligible for vaccines.
Thank you for your comments today, Caroline. Next up, we have Mark Watson, followed by Carmel Chamber Jenny.
Good afternoon, Madam Chair and Board of Supervisors. My name is Mark Watson. I'm the General Manager for Inns by the Sea in Carmel. We operate 5 small hotels. We are not in favor of the proposed ordinance, but if a mask mandate is to be considered, we agree with the Monterey County Hospitality Association letter sent to the Board of Supervisors requesting that there be an exception to the mask mandate for groups that require proof of vaccination or a negative COVID test within 72 hours. This practice is consistent with the state's mask policy guidance, and it is already in place at our hotels and is more protective than a mask mandate. Another concern we have is that the proposed mask mandate may actually undermine the vaccination effort by giving the unvaccinated public the impression that they don't need to get vaccinated. They can simply wear a mask indoors instead. We know that 98% of serious infections are occurring among those who are unvaccinated. Lastly, should a mandatory mask ordinance be passed today, we would request that it be for a period of 30 days and not 60. The ordinance can always be extended if necessary. This is especially important since you are considering enacting this policy without your health officer's recommendation and at a point when the county's infection rate has already been declining for 3 weeks. Thank you very much for your consideration.
Thank you for your comments today, Mark. Next up, we have Jenny McMurdo, followed by Terry Owens.
Good afternoon, supervisors. Can you hear me?
We can. Thank you for joining us.
Thank you. Good afternoon. Thank you for hearing us today. Monterey County has been, for the most part, good stewards of the guidance given to us by the state and our own county health director for the past 18 months. And therefore, the Carmel Chamber of Commerce supports upholding the current statewide masking guidelines and doesn't support an urgency ordinance at this time. Thank you for your consideration.
Thank you for your comments today, Jenny. Next up, we have Terry Owens, followed by Ricardo Diaz Jr.
Can you hear me?
We can. Thank you for joining us.
Thank you. Hello, my name is Terry Owens, and I'm the general manager at Embassy Suites, Monterey Bay Seaside. I wanted to speak to you because I am concerned about the effect that this proposed ordinance will have on future events and meetings in my hotel. I'm also concerned about the effect that this will in turn have on our associates who've already had their lives turned upside down by this pandemic. I've heard from a couple of event planners already that they're reconsidering having events if there's a strict mandate in place. If events are canceled or postponed, many of my food and beverage associates who want to work will not receive very many hours, if any. I've hired back many associates over the last few months. They're getting vaccinated, they all wear masks, they follow appropriate COVID protocols designed to help stop the spread of the disease. And all indications are that all of our collective efforts are paying off in Monterey. Our associates want to work, they need to work, and more importantly, they want their lives to get back to normal. In fact, I'm regularly asked by our associates, when do you think we'll get back to our normal hours? With this ordinance as it's proposed, it will certainly take longer than we would like. Thank you very much for your consideration.
Thank you for your comments today. Next up, we have Ricardo Diaz Jr., followed by Kim Stemler.
Hello, thank you. My name is Ricardo Diaz. I'm calling from Castroville. I'm for amending the language and making changes to the full mandate written. I am not. If not amended, I'm against it. Statewide is doing great here in Monterey County. And it really burns me to disagree with some, but burns me even more to agree with some other folks at this point. I mean, this time. I'm sorry. I'm sorry. I'm sure everyone is aware of the effects of children. Your words suggest the future has happened. You mentioned keeping everything open and running, how we can with mandates. How can we with mandates that will keep people away or not working because of their own status? By making up your minds now or an end to motion before your constituents that you haven't heard from all yet isn't. Anyways, don't you believe that we are already on the right direction? Your directions, our number proves it. These schools and districts are going crazy, making rules to athletics for masks, compromising health, sending kids home a week or two for another classmate. People want what you tell them to want in the most part. If the person that is worried at a restaurant or establishment is in danger, then they should mask up. Some have made up your minds already. The other, whoever, stand strong. The world is watching you. Thank you.
Thank you for your comments today, Ricardo. Next up, we have Kim Stemler, followed by Dee Landoli.
Hi, Chair Askew and Supervisors. Today, this is Kim Stemler. I'm speaking on behalf of the Monterey wine industry, representing both ag and hospitality. I hope you know the health and safety of our employees and our community are critically important to us. We estimate that over 90% of our wine industry is vaccinated, and many of our workplaces mandate indoor use of masks. I say this to remind you of our commitment to combating COVID. As a reminder, the state has existing mask mandates. Everyone, vaccinated and unvaccinated, have to wear a mask in public transit, healthcare, schools, adult and senior care facilities, childcare, correctional facilities, homeless shelters. Masks are required for unvaccinated people in all indoor places. So the only people that are being added are vaccinated people who don't wear masks. And I do wear a mask. The issues we'd like you to strongly consider before you approve an emergency ordinance. And I'm not going to repeat what Rick Aldinger said. I just want to ensure that any violation is only against the unmasked individuals and that employers and staffs are not enforcers and shouldn't be responsible for the actions of individuals. Also, communicate clearly with the public what metrics are being used to decide when masks will no longer be needed, like infections, vaccinations, hospitalizations, or as one person said, a certain percentage of children being vaccinated. What is it? Will the chaos and stress caused by families be lessened by wearing masks? And are we weakening faith in government by creating an urgency ordinance without data?
Thank you for your comments today, Kim. Next up, we have Dee Landoli, followed by Mayor Libert.
Thank you. My name is Dean Iandoli from Carmel Valley. To the board for the past 18 months, I'd like most residents of the county who follow the recommendations of your board with regard to COVID policies, and the board in turns follow the recommendations of the Monterey County Health Department. And we've heard science and data repeatedly. We're sick of it, actually. And here now we have a case where the science and the data no longer seems to be important in this issue. So it's clear that there's two supervisors on this board that have already made up their minds and seem to be following anecdotes as the new science and data, which a term like overwhelming is not science and data, it's subjective. So I'm going to instead just speak to Supervisors Phillips and Lopez because they seem to be standing, or at least coming to stand by the science and their beliefs. And I implore the two of you to stand by this and vote no on this. This is not based in science and data. The chief health officer has made it very clear that the science and the data does not support this. The two supervisors know the right answer, and by voting no would demonstrate true leadership. And I would also ask my own supervisor, Supervisor Adams, to also vote based upon the science and the data and not on anecdotal stories. Thank you.
Thank you for your comments today. Next up, we have Mayor Libert, followed by Peter Montier.
And Chair, I would ask for professional courtesy of 3 minutes since our cities did not get an opportunity to weigh in. Would that be possible?
We've got many comments left to hear. So I would just ask that you keep it as brief as possible, Mayor.
Absolutely. So I'm not here to discuss the validity of wearing masks. I'm specifically here to discuss the authority of this ordinance within the jurisdiction of our cities, and most importantly, the authority of this board to impose their will upon the populace of this county to take away their choice. Chair, you have children. It is your right to make decisions for what's best for yourself and your family. I find it inconceivable that the board would even consider to take that right away from another mother or parents to make choices that they feel best for themselves and their family, no matter the justification you use. The most important duty of an elected official is to uphold and protect the Constitution of the U.S. There is no justification to take away a person's right to choose. All through this pandemic, we have been told to follow the health officer's orders. The counties and cities have all worked together to great success, but now since the board couldn't convince or force the county health officer to change his order, you now take it upon yourselves, setting a different standard. I think that this is wrong. I think it disregards all the trust and teamwork built this last 1.5 years. You are not our parents. We are not your children. Individuals alone have the right to determine the course and destiny of their lives. That includes whether or not they want to wear a mask. You may not agree with those decisions. You can vehemently agree, but it's not your decision to make. The proper role of government is to provide resources, which the county has done a great job, provide recommendations to the people, and provide them information so they can make the best decisions for themselves and their family. I am asking you to uphold your oath to our Constitution, uphold the right for people to choose what's best for themselves and their family, and vote no on this ordinance. This is a 4/5 vote, so this county just needs 2 people to stand for the Constitution and a person's right to choose what's right for their own bodies, themselves, and their family. I'm hoping all 5 of you will vote to protect the person's right to choose, because there are no justifications to infringe on our constitutional rights of individuals. And furthermore, I do disagree with the county's assertion that you have authority to control our city's jurisdictions. Chair, board, I appreciate your time.
Thank you for your comments today, Mayor. Next up, we have Catherine, followed by, I'm sorry, next up we have Peter Montier, followed by Catherine.
Hi there, can you hear me?
We can, thank you for joining us.
Yeah, Peter Montier, Pacific Grove Chamber of Commerce. We echo the comments made by MCHA in their letter to the board dated September 3rd and support amending the proposed ordinance accordingly if you choose to approve it. There's ample information available surrounding the efficacy of being vaccinated, and imposing additional indoor masking requirements on those who are fully vaccinated is needlessly redundant, especially when such individuals are in the exclusive company of other fully vaccinated folks. Further, it's clear to everyone in hospitality that our industry won't recover from the pandemic for years. According to data from Visit California, that won't be until 2025 at the earliest. Group business is essential to that recovery right now, and our hotels and inns are booking minimal group. Leisure is carrying our industry, and that's not going to last. Unless we can count on a balanced mix of leisure and group in our lodging establishments, our industry locally will continue to suffer, and this recovery will take longer. Group is important for every jurisdiction in the county. In Pacific Grove, Asilomar produces about a quarter of our city's TOT, and it's a conference facility. Because of the decline in group, they aren't selling their full capacity, and our public services will suffer as the tourist season winds down. Group needs to return, and it can with less friction if an amendment like the one proposed by MCHA is incorporated into your ordinance. So if you decide to approve the ordinance, we urge you to consider the exceptions requested by them in their letter. Thank you.
Thank you, Peter, for your comments today. Next up, we have Catherine, followed by Jenny Stebbins. Catherine, you'll need to manually unmute your microphone so that we can hear you. We have Catherine up for comment now, followed by Jenny Stebbins. All right, moving on to Jenny Stebbins, followed by Al. Jenny Stebbins for comment.
Hello, my name is Jenny Stebbins and I live in Pacific Grove. Thank you for your time today. I would like to read you this statement on a patient page in the Journal of the American Medical Association regarding masks, and this is as of this morning. Face masks should be used only by individuals who have symptoms of respiratory infection, such as coughing, sneezing, or in some cases, fever. Face masks should not be worn by healthy individuals to protect themselves from acquiring respiratory infection because there is no evidence to suggest that face masks worn by healthy individuals are effective in preventing people from becoming ill. Face masks should be reserved for those who need them because masks can be in short supply during periods of widespread respiratory infection. Because N95 respirators require special fit testing, they are not recommended for use by the general public. There are many more published studies about the failure of masks to stop a pandemic and about the harms they cause both physically and mentally. Therefore, I request that no mask mandate be implemented now or in the future. Thank you for your time.
Thank you for your comments today, Jenny. Next up, we have Al, followed by Curt Gonzalez.
Hi, my name is Al. I'd like to start off by saying I support the mandate. I also find it ironic that hospitality entities are now endorsing the health officer's recommendations now that those recommendations are in their favor. The mandate is not extreme. I mean, if I hear a lot of people talking about their rights and their freedoms. I mean, they feel they have the right and they want the freedom to spread a deadly virus. I mean, Do they need the freedom to not wear their seatbelts? I mean, that's a restraint. I hear the word restraint. A seatbelt is a restraint. We need that. You're not allowed to. They don't have problems with people being infringed on their rights to drink and then get in their car and drive. It's the same thing. It's a public health risk. We need to keep the public safe. Every business on the peninsula, every single business on the peninsula isn't worth a single life. Not a single life. I mean, how I hear the talk of how long it's going to take the hospitality industry to recover here. I mean, how long is it going to take the 546 people in Monterey County who have died of COVID to recover? They're never going to recover. Employees are already required to enforce all kinds of things. I mean, if somebody comes walking in with no pants or something, what are they supposed to do? I mean, there's all kinds of stuff that employees have. It's ridiculous to say that employees can't tell somebody to put their mask on. The CDC recommends masks in substantial areas. Monterey County is still in substantial, recommended to wear a mask here. You can be free at home where you're not endangering other people. Don't wear your mask at home. Thank you.
Thank you for your comments today, Al. Next up, we have Carol Kuzdeni, followed by Diane Goldman.
Hi, can you hear me?
We can. Thank you for joining us today.
Good. Thank you for letting me speak. I sent you all a letter, an email on Friday, and it had a lot of documentation about how children all over the world are really suffering from wearing masks, physically and emotionally. And if you didn't get to read this, look at this documentation, I ask you please to do it before you take this vote. Now, China did a study with 11 million people. There is no asymptomatic transmission. And how we are determining the cases is by the PCR test. Carrie Mullis, the inventor of the PCR test, said that test should never be used for diagnostic purposes because you can find anything with it. He conveniently died a month before the Wuhan happened, so he's not around to protest the way his test is being used. If you do enough cycles, you can find a piece of virus from 10 years ago, and that'll give you a positive result. And dead virus means nothing. So if this is a case-demic, not a real pandemic, this is what these numbers are based on. And I know, for instance, a friend of mine, his aunt went to the hospital for pneumonia. They put her in isolation, tested her 3 times for COVID. She tested negative 3 times, and they still put positive on her chart because Medicare pays $4,000 for pneumonia, but they pay $19,000 for COVID, and they pay $39 for.
Carol, I'm sorry to interrupt you, but we do ask that everyone monitor the clock. Next up, we have Diane Goldman, followed by Janine Chikarat.
Good afternoon, Madam Chair and members of the board. My name is Diane Goldman. I'm General Counsel for Pebble Beach Company. At Pebble Beach Company, 85% of our workforce is fully vaccinated, and we've never stopped requiring our employees to wear masks while working indoors. We are generally supportive of a temporary indoor mask mandate in the county, but have 2 specific requests for your consideration. First, we request an exemption to the mask mandate for group meetings and functions, provided they satisfy specific vaccination and testing requirements. We propose that if all attendees are either vaccinated or receive a negative test result within 72 hours of arrival, they be exempt from the mask mandate while meeting with other participants who satisfy these same rules. This policy encourages attendees to get vaccinated and removes the potential for conflict between employees and guests. Accordingly, we support the exception for group meetings and indoor gatherings as outlined in the letter from the MCHA. Second, we encourage you to set a 30-day time limit for the ordinance. The trajectory of COVID is changing rapidly, and numbers have been dropping in the county over the past 3 weeks. Businesses and residents place great trust in the Board of Supervisors, and we believe acceptance and compliance will be greater if the mandate is limited in scope and duration. Thank you. That concludes our comments.
Thank you for your comments today. Next up, we have Janine Chikarat.
All right. Good afternoon, Madam Chair. I'm behind Janine. I didn't know she was right in front of me.
Good afternoon, Madam Chair and the board. Thank you for having a special meeting today to take up this serious topic. Similar to Pebble Beach, we are here today to ask for you to add language to the ordinance to include an exception for our group business. The state has set clear guidelines for groups that are working. Groups are requiring proof of vaccination or a negative test 72 hours in advance. Some groups have gone so far to set up testing sites for their event and have turned away attendees who have tested positive. Implementing a mask mandate for groups is counterproductive. We want to continue to encourage people to get vaccinated, and giving groups an out to simply wear a mask is not in our best interest. Groups are hesitant, and in some are looking for excuses to cancel. A mask mandate that includes groups can push them to cancel, including CWDA, the conference some of you may be attending next month. At our hotel and many other businesses, we've led by example. Businesses like Pebble Beach just commented on, or the aquarium, have required masks for both employees and guests, recognizing the responsibility for children who at this time are not eligible for a vaccine. Our employees have never stopped wearing masks, nor will we until we're all safe. We simply ask that you allow to continue to follow the state guidelines for groups, guidelines that are clearly working and are even more effective than wearing a mask. Thank you.
Thank you for joining us and for your comments today. Next up, we have Tom, followed by Diana Snell. Tom, you'll need to unmute your microphone to share your comments with us. Following Tom, we have Diana Snell. All right, we'll move on to Diana Snell for comment next.
Hi, can you hear me?
We can. Thank you for joining us.
Thank you. I just implore the board to do this mask mandate. I have 3 young children. None are able to be vaccinated yet. To get a message on my phone saying my child has been exposed to COVID almost every single day has been upsetting, to say the least. I implore you to protect our vulnerable citizens at this time. They don't have the same options, and they are American citizens. They are also trying to live for the pursuit of life, liberty, and happiness. So I implore you to please, at least school-age children, require a mask mandate inside and outdoors while they're on the school property. Thank you.
Thank you for your comments today, Diana. Next up, we have Angela, followed by Amanda Whitmire.
Hi there. My name is Angela. I'd like to say good afternoon to everyone. I'm thankful for the residents and the parents who spoke up against this mandate. Great job. As a Monterey County resident and a parent of young children, I strongly oppose this mandate. To the supervisors who are considering voting against this, please stand strong and do not cave. I'd also note that it's quite ironic that Supervisor Alejo says today that he cares so deeply about saving lives. Mr. Alejo, please hear your own words next time you opt to drink and drive. So upsetting. Also, please remember to vote yes to recall Newsom September 14th. Vote in person. Thank you.
Thank you for your comments today, Angela. Next up, we have Dr. Whitmire, followed by a phone number ending in 769.
Hi there, my name is Amanda Whitmire. I live in Monterey. I'm a trustee on the MPUSD Board of Education, but today I'm speaking as an individual. I'm also the mother of 2 young kids who are too young to be vaccinated. Just last week, the CDC released a report, a study that looked specifically at hospitalizations due to COVID in children. And what they found is that just in the last month, from July to August, children ages 0 to 4 experienced a 10-fold increase in hospitalizations. And kids 12 to 17 were 10 times as likely to be infected with COVID if they were unvaccinated relative to their vaccinated peers. So what does this tell us? It tells us that children are susceptible to COVID, even being hospitalized, and 2, vaccination makes a difference. We don't have to look any further than local data to see the impacts of health measures. In our local school district, we've had 125 COVID cases since March 2020. 120 of these, or 96%, were COVID cases acquired in the community. Only 5 cases were school-to-school transmission. California as a whole has been doing extremely well lately with case rates and hospitalizations, but with all due respect to Ruth Bader Ginsburg and this paraphrasing, Getting rid of masks now would be like throwing out your umbrella in the rain because you say you're not getting wet. Please, I implore you, let's have this temporary mask mandate. Let's keep our kids safe until they can be vaccinated. Thank you.
Thank you, Dr. Whitmire. Next up, we have a phone number ending in 769. You'll need to press *6 to unmute yourself to share your comments today. And we do ask that you monitor the minute 30 timer.
Hi, my name's Jack. I just wanted to weigh in support of people who oppose this mask mandate. The study that the young lady referred to of the 11 million people that they couldn't find any evidence of asymptomatic spread. And there's been no data to support the idea of an airborne virus. They haven't been able to isolate it in aerosol. And the idea that they can't find any evidence that supports that there's asymptomatic spread, meaning people that are healthy and feel good, they can go out, they're not going to get other people sick. I don't see why we need a mask mandate that's proven maybe a reduction of 7%, maybe, to reduce viral load. And if you get COVID, you have a 99.98% chance of COVID being benign. We're going to destroy our liberties, and we're going to throw out due process because of something so benign. The idea is sick people should stay home, and maybe there's a hotline to call, some service that provides for them so that they can feed themselves and not go out and infect others. Maybe there's a treatment, and maybe they have some sort of, maybe when you get your COVID test, you could have a informational packet and maybe some numbers to call people who actually treat this disease rather than waiting for you to end up in a hospital. And to burden the businesses with this mandate is absolute madness. The PCR test cannot determine viral load. This is
Thank
not
you for your comments today. We're out of time for your comment. We have many more to hear. Next up, we have Tanya Navarro, followed by Catherine.
Yes, hello. Thank you for your time. Okay, so first of all, I would like to be in opposition to the mask mandate as well. I wanted to say that masks are nothing short than child abuse. Pay attention to the science that you claim to regard. Social skills are stunned, emotional and psychological trauma are occurring. There's no smiles, no proper facial expressions. As guardians and parents, we are being imposed upon by our education system and our medical system to systematically strip away the responsibilities and personal choices and beliefs to dictate and determine what happens with our children. Okay, now I want to bring up a couple of studies that, for example, a lot of people have been talking about masks and how they reduce it. I'd like to remind you that aerosols are far fewer droplets when breathing and talking. So it is more likely to inhale aerosols than it is to be sprayed by a droplet. Okay, and that is per OSHA. We have many studies by Dr. Jim Meehan, Dr. Peter McCollin, Dr. Anita Amani, who's an MD, who talks about children who are not at risk with getting COVID. And if so, the symptoms are extremely mild. The survivability rate for these children are 99.997. Influenza is a lot more deadly compared to this. There are studies from the UK, from Australia, from Switzerland, from France, from Sweden, from Norway that show that there is a minimal, then there's actually very, very few child transmissions in schools. I'd like to remind you that oxygen is a lifeline. Our olfactory receptors are identified in our organs and our tissue, so they are responsible for our sperm cells, our heart, our kidney, our intestines, the chemical reactions that adjust the blood pressure and stimulate hormones and secretion, triggering release of enzymes. These have to do directly with the response to cell in response to stimuli. So oxygen, when you're depriving even of a little.
I'm sorry to interrupt you, Tanya, but we do ask that everyone watch the timer. We have a minute 30 for all comments today. Next up, we have Catherine, followed by Be Nice.
Hello, can you hear me?
We can. Thank you for joining us.
Thank you. First of all, I just wanted to cite something from John Hopkins. The governmental role of public health is an agency that does basically it's a vital element that are in place and a mission that is being adequately addressed to assess, implement policy development and assure the public that everybody is safe. Public health doesn't work unless the entire public is involved. I unfortunately had the experience of learning about COVID a lot this week because two of my daughters tested positive last week in our home for 10 days. My 11-year-old and my 6-year-old daughter. One had 104 fever for 3 days and the other one had 103 fever. From one parent to another, I don't care about the businesses. I don't care about where you go to eat. I care about my children being in school, and I care about them not infecting other children at school who may have to go home, and their families that may have immune compromised people at home that they could pass it to. This is not only something that we need to think about as a society, but like this is a compassionate thing. This is a responsibility that we have. Put the mask on. Why is it a big deal? Like, I can't believe that this is we're 18 months into this and we are having an argument over whether or not we should still be wearing masks when we are still in a pandemic. So please take that into consideration.
Thank you, Catherine, for your comments today. Next up, we have B, followed by Dawn Romeka.
Hi, thank you. Can you hear me?
We can. Thank you for joining us.
Awesome. So first of all, masks are really bad for you. You're breathing in your own air. So to the person who just spoke, do some research. Do yourself a favor, okay? First of all, no studies are shown about masks even working. They're actually very pointless. And it saddens me to see children wearing masks. I oppose this, if you can't already tell. To the person who spoke several before, there is no testing for the Delta. So, and I know you're not going to answer the questions, but again, masks don't work. This is affecting people emotionally and physically. The news literally said 2 days ago, you could look up the tweet, it was at noon, September 6th, that the cases have gone lower. Fauci said in March 2020 that masks do not work. He then needed to sell the pandemic, so he rephrased it. Expect more pushback for people who wanting to go shopping like normal human beings. I am a military veteran and should not be wearing a mask. And it's very tiring going into places and having to explain that I have a medical exemption to not being able to wear a mask. I must be a walking miracle because I've been to 8 states and I've never been sick. According to health experts, I am obese. And again, I have never got COVID. And a question for you, why aren't the homeless dying by the thousands? I think that's all I have to say. Please do not bring this up. I oppose the masks.
Thank you for joining us today. Next up, we have Dawn Romeka, followed by Tom.
Can you hear me okay?
We can. Thank you for joining us.
Hey, no problem. My name is Don Ramika. I'm a small business owner here in Monterey. We sell software to the event community. So our customers are in the event industry, and obviously COVID's been tough on the event and hospitality world. And I could speak on behalf of a lot of companies throughout really the world, but primarily North America and many local companies. And I think we got to look at the economic damages. And I think it really is affecting a lot of, families from a job standpoint. I think the biggest problem that we've had in the hospitality and event industry is the middle of the week. When you cut out some of the things, obviously the conference center being shut down and some of these hotels not allowed to have groups, it's just been pretty devastating. We have a tenant that unfortunately went out of business downtown Alvarado Street. It's a wonderful couple with young kids, and they definitely wish that things were free to move. I think the good news here is we're kind of setting the tone with the numbers. Ed Marino, for a while there, I didn't really like you when it was really shut down, but I think your choice to move forward and allow people to make a decision, and we've got a lot of friends with high school kids and so forth, and the ones that need to wear a mask, they wear a mask. People that go to businesses, they wear a mask. My sister has Parkinson's, and we've kept her safe by keeping our distance and wearing a mask when appropriate. So I'm definitely for freedom here, and I think we're gaining a lot of momentum, and I think we're doing the right things by keeping things the way they are. Very much.
Thank you for your comments today. Next up, we have Tom, followed by Patrick Kennel.
Hello. Can you hear me now?
We can hear you. Thank you for joining us.
Oh, yes. Coming from a red state of Louisiana, I just like everybody to know they ran out of pediatric hospital beds. So has Texas. So these are 2 states where the anti-maskers pretty much control everything. So just so you know, also being a COVID survivor myself, I know a little bit more about it now. And I only get my information from, FLCCC. I advise everybody, look up that website, FLCCC, eye mask protocol from the Western Virginia School of Medicine. And what they're saying is it's a big failure of the medical doctors in the United States, sending people home with no treatment. I was offered no treatment. I had to fight to get monoclonal antibodies. Another thing, 60% of the people in Monterey are Hispanic that died and that caught the virus. 60%. I don't hear too many Hispanic voices on here. Hay una persona que está hablando en español. I heard one lady. So all you people that aren't really affected by this, with the United States having #1 number of deaths, over 1 million. The United States has more deaths than any place in the world. So, wearing a mask, that's not a big deal. So I would get, you better do that mask mandate if you're not. Okay, see ya.
Thank you for your comments today. Next up, we have Patrick Kennel, followed by Marilyn Golly.
Hi, thank you, Wendy. Can you hear me?
We can. Thank you for joining us.
Okay, great. So I am not a Monterey County resident. I am speaking as somebody who's come to Monterey County a bunch of times this summer. It's been a refuge from the smoke. And it has also been a refuge from the mask mandates here in Sonoma County where I am. Speaking to the economic impact, I know I can say for myself, I definitely won't be coming back to Monterey County if the mask mandate goes through. I'm sure some people will be happy about that. Some people will not be, but I think that is an impact to consider. And I don't know, I'm not going to list studies or citations of sources, but life, liberty, and the pursuit of happiness. These have been bad words in the liberal community that I've been a part of, and I have been. But liberty, like the ability to make your own decisions. And what is happening here is one subset of the population is claiming that they are justified in taking away the liberty and choice of another subset of the population. I think when some party is going to take the choice away from another, the onus is on them to really do the due diligence to really prove it. And I don't think that's been done here. So I would advocate as somebody who loves to come to Monterey County to keep it the way it is, to not impose the will of some upon the will of others. Thank you.
Thank you for your comments today. Next up, we have Marilyn Golly, followed by Tanya Navarro. And I'm not sure if we already had Tanya speak or not, but we'll double check our notes here. So Marilyn Golly, followed by Tanya Navarro.
Thank you for letting me speak today. This is all to all the Board of Supervisors. You have decided to mandate masks again on this county without the order from Dr. Moreno, which is a concern to many that you ignore. You praised Dr. Moreno with letters in the newspaper and meetings. Now you ignore him. Why is that, I ask? Is it because he won't give the order to mandate masks indoors and that stops your power overreach on us? You took an oath of office to support and defend our rights. That is never on hold. Who is protecting us when we did this for over a year? It is time now to let us decide that is right for our health and our children. This is all about control. We have no problem masking. We just want our freedom and our liberties back that you stand for, that you take the oath for, that we trusted you to do. This has been 18 months. When are you going to stop this? I'm not going to be nice anymore. This is about control. This isn't about health. This isn't about numbers. This isn't about science anymore. Stop it. Give us our life back. We have the lowest cases in the state. Thank you.
Thank you for your comments today, Marilyn. Next up, we have Tanya Navarro.
Yes, hi. I wanted to make sure that I speak in Spanish. Someone mentioned no Spanish speakers. I am a Hispanic. So I hope you guys get this in Spanish. So quería recordarles a las personas que están aquí que yo estoy opuesta.
Tanya, can you hold on just one moment? We have our Spanish interpreter who can interpret for us. So give me just a minute to get the microphone over to her.
Thank you so much.
Tanya, I ask you that you please speak slowly and loudly enough for me to hear. Take a pause after your sentence so I can interpret. You can continue.
With 1 minute and a half, it's hard. Okay.
We do give you 3 minutes, just a minute. We'll adjust that.
Okay.
You may continue.
Okay, thank you. Okay, so buenas tardes. Quería dar mi opinión en oposición a este mandato de las máscaras, porque como todos sabemos, los niños tienen una gran exposición a los gérmenes. Los niños tienen un sistema inmuno tan fuerte que no lo necesitan. Por eso ellos están equipados con cosas como T-cells. Ellos tienen la habilidad de poder generar.
I'm sorry, I'm going to need some pauses to be able to interpret for you in English. So I'll try and give the gist of that.
Okay.
As we all know, the kids have a very good immunity and they have T cells. You may continue.
Okay, well, not fully, but okay. So, a los niños les hace de más daño que bien usar la máscara porque los niños requieren respirar más oxígeno que un adulto por minuto, por segundo. Los niños ocupan, tienen que respirar más seguido y entonces al respirar su propio desgaste, los niños les afecta porque el oxígeno nos afecta a la producción de nuestro nivel de energía. Los niños ocupan poder no simplemente respirar más, pero respirar aire limpio, aire que no es el desgaste de ellos mismos, porque eso les va a causar problemas, no solamente pulmonarias, pero les va a causar problemas con su sistema nervioso.
I need a pause, thank you. Kids need to breathe more than adults and they breathe more times per minute. And this is going to affect the kids. It's affecting their system. Continue.
Yes, their nervous system, their immune system, the oxygen. La manera en que el oxígeno y la limitación del oxígeno los afecta es que el nivel de la energía, el oxígeno es responsable por 90% del nivel de energía que los niños pueden usar. No hay ninguna estudio a este día que enseña los beneficios de por qué la máscara.
Tanya, I'm sorry, did you already have a chance to speak? I just got a note from our clerk that you had already had a chance to speak.
Yeah, I wanted to do the Spanish one since people were mentioning no Spanish, no Hispanic.
So we only do one public comment per person. So I'm sorry, but I'll need to interrupt you so we can continue on with those who haven't yet had a chance to share their comments. But feel free to send us an email if you want to share additional thoughts. All right, moving on. Thank you. And sorry to interrupt. Moving on, we have Jillian Heisman.
Hi, Wendy. Thank you. Can you hear me?
We can. Thank you for joining us today.
A quick comment. I want to share that I do have a child in public school locally. I believe that we need to make sure that our children can stay safe and stay in person in school. And therefore, I do support the mask. Thank you.
Thank you for your comments today, Jillian. All right, that is our last public comment. I don't see any additional hands raised, so I am going to close public comment. We've had quite a bit of feedback to add to our conversation today. I'm going to bring it back to my colleagues on the board for conversation. And we do have a motion to adopt the resolution ordinance that has been presented earlier with a motion from Alejo, a second from myself, including the language to respond to the suggestions from our hospitality industry. Supervisor Alejo, do you want to make any additional final comments?
Madam Chair, I see that Supervisor Chris Lopez is not on the Zoom, so I don't know if he had to leave as
I'm here. I just got unpinned. I switched devices.
Got it. Perfect. I didn't see you, so I just want to make sure you were still with us. But if I could just say, I just wanted to respond. First of all, I thank everyone for coming to speak, pro and con. That's what these meetings are for. But I think there's some misconceptions being put out there. The Board of Supervisors provides rules and regulations on a wide range of issues, from noise ordinances, from food safety, water quality, building standards, road standards. We make rules and regulations to protect the public every week that we are here. And so that's why we have different ordinances, and we've done emergency ordinance on other issues as well. So this is something that we have done. We have done that before. And saying that somehow that that protecting the public is not following the Constitution, as one of our speakers said, I think that's also very inaccurate. We are not in a good situation. What we've known is that there's new variants, new and dangerous variants that are out there, the Lambda variant that are now spreading across the state. Delta variant alone in Monterey County has increased from 14 cases to 331. That's 24 times in just 8 weeks. And I take exception with some of the statements made. I'm glad one of the speakers pointed out who are the most impacted by hospitalizations and deaths in Monterey County. It seems some of our residents have forgotten who have been hardest hit. The essential workers, the frontline workers. These are the people who have to go to work in those restaurants, in those hotels, in agriculture, in many different other businesses. But 71% of the people that we have lost in Monterey County have been people of color. I believe 56% of all deaths have been Latino. So yes, I've had one too many families that I've had to help when their parent went to Natividad Hospital. They thought they were going to come back. They were going to be hospitalized for a little while, and they passed away. And then we had to help find their belongings that were lost at the hospital, their hat, their wallet, their phone, those last precious items that belong to that parent that is no longer going to come back to them. I've seen their pain. I've seen their hurt. And I'm hearing arguments of inconvenience when we are prioritizing prevention of hospitalizations and deaths among our residents. It does hurt because that pain for those families will never go away. A mask, you wear it a day. If we do an ordinance, whether it's 30 or 60 days, that's temporary. But bringing back of life could never happen. That person will never return to us, to their families, to their spouses, or to their children. So yes, if we could do something temporarily that could help save lives of our essential workers and also our vulnerable children who are not yet eligible to be vaccinated, it's incumbent upon us to act and not to wait till we're in a worse situation and then regretting that we had the ability to take action and we failed to do so. This has been frustrating. There's been other times where I have disagreed with Dr. Moreno. When there were very few vaccinations, he would not commit to setting some aside for farm workers for the mass vaccination that we have. We had to wait till a new federal program gave vaccinations to Clínica de Salud del Valle de Salinas for us to then be able to move forward. And then we had the highest rate of vaccinations among agricultural workers because of some other programs, not because Dr. Moreno supported and provided that leadership at that time. So this hasn't been always praised. We haven't always done these conversations out in public, but there has been other points during this pandemic where I've respectfully disagreed with Dr. Moreno. But in the end, we found other ways to achieve the goals. And in the end, they helped us get to where we're at today, from being one of the hardest hit areas to one of the most improved. But now we're seeing that uptick again. If you look at our chart from where we were, we plateaued in April, May, and early June. And then since late June, July, and August, our infection rates have gone up. All this data is on our website. Look at what's happening. The different variants, the cases that we have of these different variants, it's on our website. Follow it every day, document it every day, and you will see that they're increasing. They're not decreasing. We know from the last year and a half that we have two of the greatest tools to combat this pandemic. That is vaccinations and that is masks. And here we have an opportunity to utilize them at a point where we're seeing infections increase all around us in California and surrounding counties. And I think we are providing that leadership that our community needs by reinstituting these two most effective tools. I think not passing this today will be one of those decisions that my colleagues will regret, because we do have the ability to save lives. And I know on my conscience, if I could do something that could help save a life or save somebody from being hospitalized and perhaps having permanent harm to themselves, I think it's worth doing that. And if perhaps my colleagues are not comfortable with a 60-day, I would entertain to at least let's institute it for 30 days and then see, we reevaluate at the end of 30 days. But it is that important that let's not our message be that we failed to act and protect the public. If we need to take a shorter period to be able to evaluate how the next month goes, so be it. But I'm trying to find a way how we could get this across and be able to institute this. The other amendments that address some of the concerns of our hospitality, our county council have already included that. So I hope that this could be something that can move forward today by this board. Thank you.
Thank you, Supervisor Alejo. Supervisor Lopez.
Yeah, Madam Chair, I just, my concerns that I raised last week continue to persist. The concerns about breaking with our health officer, I understand. A lot of folks came with different opinions, different science, different reports. For us locally, we hire these folks to do this work. These are the people that we put our trust in. And it's not just Dr. Moreno. Well, in the past, it has been his call to make these orders. He has a team of epidemiologists who he checks in with. And my concern today is that the trend is down. I did ask him yesterday just a couple questions about our numbers over the weekend, and the numbers continue to be in a downward trend. And it's hard for me to justify stepping in now on a downward trend to say it's the time. In terms of stepping into cities, that concern continues to persist. I did have conversations with my community leaders, and I'll say it wasn't as unanimous perhaps as Supervisor Adams's district in terms of folks just being concerned about the lack of conversation before we put this out last week after such strong partnerships have been created. And so my concerns right now persist. I would love to hear from the rest of my colleagues on where they sit after hearing from the community. In terms of right now, what's in front of us, those concerns for me are the same as last week. And overall, as we look how we move forward, the concern for me is as we trend down, what is that cutoff? Even a 30-day, if the numbers are dropping as quickly as we're seeing in other communities, I believe in masks personally. I heard a lot of opinions out there. I believe in masks. I believe that they work. I believe that, I wear them when I'm in those situations where they're needed, and I make that decision that it's time to wear a mask. I know that most of, if not all of our schools are requiring them. And so I feel like there's a lot of missing information here in terms of conversations, including that piece that was raised about CDPH still requiring anybody unvaccinated when in a public space, specifically indoors, to wear a mask, right? I would be more comfortable today taking $200,000 that we have left over in that VITA program, that we say there's $1 million there, taking 200 or 100 and doing a media blitz to talk about the efficacy of masks and asking people to wear them. I think that would be more fruitful rather than asking our businesses to be that enforcement agency. So my concerns persist, but again, I know last week there wasn't a lot of folks there with me, so I'm curious to hear where the rest of my colleagues are.
Supervisor Phillips.
Yeah, I probably should have listened to Supervisor Lopez a little bit more last week. And I got to say, I started turning around last week a little bit when we addressed Dr. Moreno and heard his reason and where he was going with this. But and I worry that it has an impact of to do this now under our existing stats, that we start losing confidence in Dr. Marino's ethics that he's been things, and it's it kind of undermines his credibility a little bit, and us too, in that we're saying now we've been so forceful in saying, look, the health department has looked at this. This is the direction that we have to go, and now we have elected officials stepping in saying we disagree with it. We're moving in a different direction. I'm worried about the long range effects of confidence in what we're doing. And I think people, the universities here at the county, so many other places, my health care place, they were mandating masks and everybody was complying with it. And that we brought to the forefront now, I'm worried that it's going to have a counter effect, that we've stirred up more angst than we needed to for what we're going to accomplish. So yeah, I look at this as a real extreme action. We say it's so urgent that we have to overrule our health director and move in this direction. And with almost 80% of our people being vaccinated, with our hospital at 28 today, and with it seemed it trending down, I can't justify finding that. And I do think the mask mandate, when we're putting so much emphasis on that, can be seen as a disincentive to vaccine. And I know I talked to a gentleman who runs a big corporation. He was having a wedding and he said everybody that wants to come to the wedding has to get vaccinated. And some people who hadn't been vaccinated before went and got vaccinated, similar to what if you want to go to Hawaii or you want to go somewhere else. So I see a little problem, and I guess my biggest problem is I think we're going to need voluntary compliance to make this happen. And I worry, after we just had this hearing, whether we're going to do this and whether this is going to make it worse versus better. And enforcement is a big problem. And I just hate to see this put this burden on the businesses, where now people are going in and saying, well, this is what the businesses say they need to keep everybody safe, and we're all good with it, when it's government kind of stepping over and shoving it down their throat. I think it's difficult. So I think I would put this in our back pocket and say, let's look at it in a week or 10 days. And if we see a spike, I'm sure Dr. Marino may change his mind and step in, and then if not, then we direct it. But I think it's premature, especially on these stats. I don't think we can justify it. So thank you, Madam Chair.
Thank you. I do just have a couple questions for my colleagues, since we're having this conversation. And I appreciate what I think I hear. I'm going to throw some benefit of the doubt in here for Supervisor Phillips and Lopez. But what I hear you saying is that you want to, you support mask wearing, you support the strong recommendation that exists both from our health officer and the CDC, and that your interest is in ensuring that any action that this board takes is in fact to increase mask wearing in Monterey County. So what data, and I'm so that would be one question to clarify that is in fact the intent that I think we all share here today, that we do support masking, we do want to do everything in our power to keep our community safe, and that we do want to take action that ensures that we have the highest rates of mask wearing across the board here. So if you could clarify that for me, that would be helpful. And then, I've heard you both reference wanting to wait for data to indicate an appropriate time. What would that data be? Would it be waiting until our rates are trending upward again? Would it be waiting until we start having child deaths in Monterey County? I'm not clear on what the data is that we would be waiting for. It's clear to me that we are still in a pandemic. I don't think there's anyone arguing with that. It's clear to me that that the data from our health officer has indicated that he has made a strong recommendation in support of masks. It's clear to me that the CDC shows that our rates remain in the high and substantial spread ranking, which support CDC recommended masking for all people indoors. I'm disturbed a little bit by the suggestions that were made today around masking not being effective or working. I think that we can all agree, and that I think I would want to make sure that any message that comes out from a decision made by this board is not misconstrued in any way, that we know that masks prevent community spread. We know that. We know that the children who are getting COVID right now, it's from community spread. And so our actions today, I think, will be telling and will be interpreted by the community in ways that may not be as we intend. So I'm interested in hearing a little bit more about your thoughts and feelings in terms of what is the data that you would want to wait for, and how can we ensure that our actions today are not misinterpreted in ways that we don't intend for them to be. So I'll pass it back over to Supervisor Adams. You have your hand raised, but I would like to hear from Supervisor Lopez and Phillips again.
Well, yeah, let me just say, I strictly believe in masks. I think they're effective. Other people don't. I do. My wife points out the fact that she and I haven't, and we always get sick 2 or 3 times a year. We haven't got sick in a year and a half, and she attributes it to to our mask. But I do think that it may be more effective using some of the money that Supervisor Lopez talked about to encourage people to use masks, especially with the numbers increasing at the schools. But to come to the correlation then that the schools where the students are wearing masks and where the teachers are wearing masks, and now they're getting infected, to now say, now that correlates to we have to mandate everybody's mask indoors in every situation, I think is an overreach. And so I do think we can spend some of this energy on encouraging and helping people to get masks and provide the mask, and maybe we go and fund masks out in front of the businesses on it. I think of those things, but I would certainly, yeah, if our numbers continue to trend downward, I would not support the mandatory mask. If they start moving upward, that's why I said we maybe take a look at it every single week to see if we think it's so drastic we got to move on it.
And I would, for my part, I think I was pretty clear there, but I didn't go to college to be a doctor. I didn't go to college to be an epidemiologist. We hire those people and the best that we can find in this space to give us this advice and to help us make these decisions, in some cases, to make the decisions on our behalf in the case of Dr. Moreno. And at this point, they are not telling us that it's necessary, yet we are choosing to have this conversation. And in terms of what I would see and what would make me change my position, yes, it's increasing cases, not over a certain level, but a trend that is upward. If we had had this conversation 3 weeks ago, you probably would have heard a different opinion from me. But as we are trending downwards, for us to step in on our healthcare professionals that we hire to make these decisions is a place that I am currently uncomfortable, given the faith that we have placed in our team, our entire team, not just Dr. Moreno during this pandemic. And it's been a long 18 months, and I was chair when this whole thing started, and I've got a child under 5 at home. I've got some of the same concerns, but we take our precautions. But I'm looking to the professionals who look at that macro level and have the expertise as well as the degrees to parse this data to help us make these recommendations. And when they've advised against it, it makes it hard for me to stand here and say, let's go, let's do this.
Supervisor Adams.
Thank you. I sort of feel like my comments are virtually moot because it looks like the board has come down pretty squarely. Although I must say that I think all of us are on the same page when it comes to finding a solution that we could all agree to. I think that's just really important. I'm sort of all over the block here. when I think about the children, and that's really where my biggest concern has been, the outbreaks that we're seeing in schools for those who are simply too young to be vaccinated. I just feel that as much as we can possibly do to try to keep the families' lives from being in a state of constant chaos, listening to the woman who's now got 2 of her kids back home, you know, has a total change in the way one has to conduct your own ability to make a living so that you are able to take care of your kids is just problematic. And I feel that as much as we can possibly do to retard the spread of COVID in the schools is really important. So on the one hand, from my perspective of being concerned about children and families, I certainly support the idea of doing this. Where I really cough though is thinking about the data just once again. And as Chris had said, Dr. Moreno and his entire team, we did not agree with Dr. Moreno, you know, when we were going through this beforehand. And it was a lot of work for many of us to try to keep us on the same path of agreement with him, because there were a lot of people that wanted to counter what he was saying. I'm looking forward to hearing from him after he's listened to the same public comments that we have. I want to go back and take a look at the data, with him, his comments on the data as it stands now. I think when people talk about supervisors overreaching and people's freedom being trampled on, you know, when I took this position and when I took my oath, I had just a totally strong feeling that I was elected to protect the health, the safety, and the welfare of the residents of not just my own beautiful supervisorial district, but for our entire county. And in my opinion, to do that, I have to take stands that may not be popular or may not be in accord with a lot of the other people. And although and therefore I feel like I should be supportive of a mask mandate, because I think that would be very helpful in this regard. And it would make my heart feel better not to have one more incident of COVID among anyone. And if the vote that we took today ensured that would happen, that would make me feel a whole lot better and make me feel like I am doing my job, the job that people elected me to do. In the last couple of weeks, I've had the opportunity to be both in San Francisco and another major city in the country, all of which had the mandated mask and vaccination caveats. And everybody just was doing it. You know, it wasn't like it was this major problem. Everyone seemed to be okay. Nobody, you know, I didn't see anybody chomping at the bit of anger because they had to wear a mask, you know, or show their vaccination and ID card. It wasn't like that at all. When I think about the shops, I think as well that if we had a mask mandate in place, it would take the burden off those frontline workers who are the people in the shops, who are the people in the restaurants or wherever else they may be, to have to say, listen, you know, this isn't me, it's the county. They said we have to do this. And it would just take a little bit of the pressure off folks who are having to interact with the public in that regard. I think it would be helpful. I think the bottom line is that I am supportive of this. I am. I would like to hear just a little bit more information. Dr. Moreno's view of this data changes, which is why I had mentioned in my very opening remarks that I felt I would feel more comfortable if we were doing this on a 30-day basis. If we would look at it, not over 60 days, but just let's look at it in 30 days and see where we stand. If the data continues to look favorable as half of the group seems to say, then I think we can revisit whether or not we want to continue. If we're seeing this continued rise in the schools and the kids, you know, those are some of the measure points that I think we need to look at, and I would be happy about that. I have a meeting tomorrow morning with my 3 mayors, and I wish I had the opportunity to talk with them in a group again before having to make this decision today, because I want to make sure that we've got the major folks who are going to be impacted by this, those who are in the city, on the same page as we are. So here's what I would feel. I would be supportive of this if it were not going into effect as quickly as it is, so that we each have the opportunity to talk to the mayors within our communities to ensure that we generally are on, that those of us in elected positions are on the same page with this. And that we would be able to come back and revisit in 30 days. And of course, to keep the language in about the, whichever way we go, the language from MCHA and our largest employer. So that's where I stand on this. Thank you.
Thank you. Supervisor Alejo.
Yeah, I just wanted to add that, yeah, I understand this is one of those tough but critical decisions for our community, but this is not about finding an easy way out of what I think we all know would really help curb this pandemic. By saying just put more money for more education, we've already done that. We've spent hundreds of thousands, if not millions, on our communication teams, on commercials, billboards, bus signs, literature, social media, videos, you name it. We've done that on masks and on distributing masks and making them available. We've done that throughout this pandemic as soon as we had them in our hands. So also we have other county professionals, but doesn't mean that we always agree and just follow whatever they say. We have a very professional county council team of some very good lawyers, but doesn't mean that all of us just rubber stamp whatever they say. We have a CAO, a very experienced CAO. He gives recommendations to the board on a wide range of it. Doesn't mean that we agree with him 100% of the time. And in fact, hearing Supervisor Lopez, we've disagreed quite a few times, and we've had to push to get to where we wanted. We eventually got there, but initially Dr. Moreno was not supportive on priority testing for farm workers and later priority vaccination for farm workers. He was unwilling to do those. And then on numerous data sets that are now the standard in Monterey County, we've had to push. For a while, he didn't want to release data by region or by race. Most recently, he didn't want to release the data on deaths and hospitalizations among the vaccinated and unvaccinated. They're available now. If you go to the website, they're available now. But we had to push every week, keep asking, when are we going to get that data? The public wants to know. The press is asking for the data. We've had to push many times. So it's not like we just follow everything that he's done. And in fact, the things that we have available now, it's because of our work and advocacy as board members, knowing that it was the right thing to do for the public to have the widest range of information quickly. Sometimes it was frustrating because it took weeks, if not months, for it to get put online. But I'm just restating that it's not, we just don't follow blindly on every issue. We do make decisions every week on behalf of our residents because we're the elected officials. We're elected to make critical decisions that protect the public and make the lives better of our residents on every issue that gets put on this agenda. So let's not act like we just have to follow one professional because that's his opinion. Every person has an opinion. Yes, we listen, we hear the arguments, but in the end, we're the elected officials that were put in this position to make decisions on behalf of our constituents. And like I said, if this is going to help save lives, let's do it. Let's not have to wait. I know that our numbers are going to get worse the way things are going out. The odds are against us. And it would be shameful. It'd be a sad commentary on Monterey County that our board had to wait till things got worse, till more people died or more people got sick before we decided to do what we already know is one of the most effective things to save lives in our county. That's all I wanted to say. Thank you.
Thank you, Supervisor Alejo. So I think we could probably talk until we're all blue in the face. I'm not hearing that there are 4 votes for this, but I do just want to again make my case to my colleagues that the data are going to trend up again. If anyone disagrees with that that reality, I don't believe that we're going to trend down to nothing at this point. We can only expect that the trends will go up. We are elected to these positions. We're expected to do the right thing for the right reasons. The data clearly tells us that Monterey County remains in the CDC high and substantial spread rate. The data clearly tells us that children are missing school yet again another year because of community spread. The data is telling us we're in the middle of a pandemic, and as elected officials, it is our job to keep our residents and our community as safe as possible. Similar to stop signs, where our action to stop protects those around us. The mask that I wear protects the people that I'm around, and the mask that they wear protects me and my children. I believe that we owe it to our community to do the right thing today, to take action, to initiate an indoor mask ordinance. And we do have a motion and a second. I am going to call for the vote. Want to appreciate everyone who's taken the time to communicate to this board with your thoughts and opinions on this, including the over 24 local elected officials who did submit a letter speaking on behalf of themselves and their constituents that this is something that they believe is the right thing to do, and at their urging for this board to take action in a way that only we can today. So we'll proceed by calling for a vote.
Supervisor Lejo?
Aye.
Supervisor Phillips?
No.
Supervisor Lopez?
No.
Supervisor Adams?
Aye.
And Chair Supervisor Root Askew.
Aye. With that, this fails because it needed a 4/5 vote. So we will, I'll look forward to bringing it back again for consideration when our rates inevitably rise. With that, I believe we need to go into closed session. So we will adjourn this meeting from closed session and recess into closed session for item number 1A. We do need to call for public comment on closed session items. So if anyone has a closed session comment, this would be regarding providing direction to our labor negotiators for Unit S. I have a few hands raised for closed session public comment. We're going to stick with our minute 30 for public comment. And this would be specific to our closed session agenda regarding a negotiation with Unit S. Carol, we have Carol followed by the phone number ending in 376. All right, we have the phone number ending in 376. You'll need to press *6 to unmute yourself. All right, we no longer have any public comment hands raised for closed session. We will adjourn to closed session, where we will recess to closed session, where we will adjourn from closed session unless there's something to be read out by County Council.
That's correct, Chair. I
Did I get that right?
Yes, I don't anticipate anything to be reported out, but if necessary, we can do so either at the end of the day today or next week.
Right. Thank you very much.